CNA online practice test free. Welcome to the quiz. Question 1. You are caring for Mr. Kenneth Robinson, an 88-year-old male patient who has been receiving end-of-life palliative care. He is approaching the end of his life. His family members are at the bedside, and staff are focusing on comfort measures rather than curative treatment. You want to provide supportive, compassionate care. Based on best practices for caring for dying patients, which statement about death and dying is most helpful for a patient in end-of-life care? Option A. Avoid discussing the patient's condition and approaching death entirely. Option B. Allow the patient to express his feelings and concerns, maintain his dignity, provide comfort care, and support both the patient and family emotionally. Option C. Focus only on medical interventions and ignore the patient's emotional and spiritual needs. Option D. Tell the patient not to worry about dying and to focus on getting better. The answer is B. End-of-life care emphasizes dignity, comfort, emotional support, and open communication. Option B is correct. Options A, C, and D are not supportive. Question 2. You're assisting Mr. Lawrence Cooper, a 75-year-old male patient with ambulation and mobility. You are planning to use a transfer belt to provide support and prevent falls during his movement. You need to position the transfer belt properly. Based on proper technique for using a transfer belt, where should the belt be placed? Option A. Around the patient's chest under his arms. Option B. Around the patient's waist over his clothing at the level of his hip bones. Option C. Around the patient's hips very loosely so it will not restrict his movement. Option D. Around only one side of the patient's body to allow greater mobility. The answer is B. A transfer belt is placed around the patient's waist, over clothing, snugly but not too tight, at the hip level. Option B is correct. Option A, chest placement, is incorrect. Option C, loose belt, is unsafe. Option D, one-sided, is incorrect. Question 3. You are participating in a quality improvement initiative focused on fall prevention in your facility. Part of the initiative includes modifying patient environments to reduce fall risk. You understand that the patient environment significantly affects fall risk. Based on proper environmental modifications for fall prevention, how should a patient's environment be modified to prevent falls? Option A. Scatter furniture throughout the room to provide walking pathways through the space. Option B. Ensure adequate lighting, keep walkways clear and free from clutter, provide grab bars in bathrooms and near beds, and remove tripping hazards. Option C. Keep the environment cold to help keep patients alert and awake. Option D. Remove all furniture from the patient's room to prevent any obstacles. The answer is B. Fall prevention includes good lighting, clear pathways, grab bars, and removal of tripping hazards. Option B is correct. Option A increases fall risk. Option C, temperature does not prevent falls. Option D, removing all furniture is impractical and unsafe. Question 4. You are assisting Mrs. Dorothy Williams, an 80-year-old female patient, with hygiene care. During the process of helping her wash and change her gown, you accidentally expose her breasts momentarily while changing her gown. She appears embarrassed and uncomfortable about the exposure. You recognize this is a sensitive situation. Based on appropriate response to accidental exposure of patient private areas, what should you do? Option A. Ignore the exposure and quickly move on without acknowledging what happened. Option B. Explain what happened and protect her privacy immediately by covering her and apologize for the inadvertent exposure. Option C. Tell other staff members about the exposure and laugh about the incident. Option D. Make a joke about the exposure to try to lighten the mood and make the patient less embarrassed. The answer is B. If you accidentally expose a patient, apologize, cover them, and maintain dignity. Option B is correct. Option A dismisses the patient's feelings. Options C and D are unprofessional and disrespectful. Question 5. You're assisting Mrs. Patricia Clark, a 72-year-old female patient who has osteoarthritis affecting multiple joints, including her knees, hips, and hands. She experiences pain and stiffness with movement, and she has limited range of motion. She is asking for your assistance with positioning and gentle movement. Based on appropriate care for patients with arthritis, which approach is most appropriate? Option A. Avoid moving the affected joints at all to prevent pain. Option B. Encourage gentle movement and assist with positioning for comfort, provide support to affected joints, and perform gentle range of motion exercises to maintain mobility. Option C. Force the affected joints through a full range of motion daily regardless of pain. Option D. Keep the patient immobilized completely to prevent any discomfort. The answer is B. Arthritis care involves gentle movement, positioning, and ROM within pain limits to maintain function. Option B is correct. Option A leads to stiffness. Option C can cause injury. Option D is counterproductive. Question 6. You are working on your unit when you provide care to Mr. Anthony Carter, a 68-year-old male patient. During care, the patient becomes increasingly angry with you, raises his voice, uses harsh language, and appears hostile. You feel uncomfortable and defensive about his treatment of you. Based on appropriate response to verbal abuse from a patient, how should you respond? Option A. Become defensive and argue back with the patient to defend your actions. Option B. Match the patient's tone and verbal aggression to show him you are not going to tolerate his behavior. Option C. Remain professional, stay calm, set clear boundaries about acceptable behavior, and report the incident to the nurse. Option D. Refuse to care for the patient for the remainder of your shift. The answer is C. When a patient is verbally abusive, remain calm, set boundaries, and report the incident. Option C is correct. Options A and B escalate the situation. Option D may be necessary if safety is compromised, but reporting is still required. Great job! Don't forget to subscribe. Bye.